Hi everyone. First off, congratulations on making it to trigger. I'm Nurse Lauren, and I'm going to be demonstrating how to administer the HCG trigger injection. This medication could come under a couple different names. You could have either HCG, human chorionic gonadotropin, or you could have a medication called Pregnol. Both are the exact same medication. Prior to administering your injection, your nursing team will instruct you on the dosage that you're going to be administering. I'm going to be demonstrating how to administer 2,500 units of HCG. To get started, you'll want to grab your supplies. So you'll need your sharps container, a 25 gauge 1.5 inch needle, your 3 milliliter syringe, your medication, and then an alcohol swab. To start, you'll take your syringe. It may or may not already have a needle attached to it. If not, you recommend either a 22 or 25 gauge needle to mix the injection. You'll notice when you open the box, there's going to be a vial of powder and a vial of liquid or diluent. For demonstration purposes, we're going to say that the green vial has the powder in it and the gray vial has the liquid or diluent in it. Next, you'll want to pull back on the syringe so you have 3 milliliters of air. Next, you'll want to remove the cap of the needle and inject the 3 milliliters of air into the liquid vial. You'll then flip it over, making sure that the tip of the needle is completely submerged in liquid, and then you'll pull out 3 milliliters of liquid. Next, you'll want to take your vial of powder or the medication. You'll take off the cap and then inject the full 3 milliliters of liquid into the powder. You'll need to go back to the liquid vial and then withdraw an extra 1 milliliter of liquid to put into the powder vial. So since your syringe only has 3 milliliters, you'll pull back just to get the 1 milliliter. Same thing, push the air into the liquid, and you'll withdraw just 1 milliliter of liquid this time. Next, you'll take that and inject it into the powder mixture and inject the full 1 milliliter of air. That way you'll have a total of 4 milliliters that you've injected into the powder vial. Once it's completely mixed and the solution is clear, you'll then flip over the vial and withdraw 1 milliliter of mixture. You'll then take the remaining amount of medication and place that into the refrigerator just in case you need it the next day. After you have the mixture back up in the syringe, you can then take the needle cap and then recap the needle and twist it off and place this needle into your sharps container. You'll then take your injection needle, which again is the 25 gauge 1.5 inch long needle, and you'll screw that onto your syringe. Next, you'll want to make sure that there's no large air bubbles in the syringe. So to do so, you'll want to lightly tap the syringe, which will cause any large air bubbles to go to the top. Next, you'll want to prime the needle, and you'll do so by slowly pushing up on this plunger so that any large air bubbles are pushed out of the syringe, and you'll notice there'll be a little droplet of fluid that'll appear on the tip of the needle. Now that it's time to inject, you'll take your alcohol swab and clean an area off on the upper outer quadrant of your butt. You'll then remove the outer cap of the injection needle. You'll notice that the needle is a little bit longer because this is an intramuscular injection. You'll then insert the needle completely in, kind of towards your hip, push down in the plunger to administer the full dose of the medication, remove the needle at 90 degrees, and then you can use a gauze pad to apply pressure. You can then take your needle, and you can place this entire thing right into your sharps container.